Welcome to BLR training. Many people experience some days when they feel down or sad. This might be because something has happened to cause feelings of sadness, or every now and then people just feel sad for no reason in particular. But when that feeling of sadness is constant and interferes with a person's ability to do daily tasks, then it could be a more serious illness called clinical depression. Employees who have clinical depression may have difficulty performing the necessary tasks of their job. As a supervisor, you may be faced with employees who have depression. This training will help familiarize you with this illness and what you can do to help. Be sure to ask your supervisor or trainer if you do not understand any of the information presented in the program.
Hi, I'm Laura Piper, licensed clinical social worker. Every day I work with all types of people, many of whom struggle with mental health issues in the workplace. During this training, I'll be talking about ways you as a supervisor can help your employees who may have mental illness. The main objective of this particular session is to help you understand what depression is and how you can help employees who are dealing with it. By the end of the session, you will be able to understand what depression is, know the causes and symptoms, understand how it can affect work, know what the law says, and learn how to manage employees with depression.
Before we begin the session, let's take a few minutes to see how much you already know about depression. When you're ready to begin, select Next. Select True or False, then Submit.
Depression can have a very significant effect on the workplace, and that effect can vary depending on what your occupation is. Select each tab to learn more. 18.8 million American adults, or 9.5% of the adult population, suffer from a depressive illness. About 80% of people with depression reported some level of functional impairment because of their depression. Only 29% of people with depression contact a mental health professional. However, research suggests that 80% of patients with depression will improve with treatment. People with depression miss about 19 workdays and suffer 46 days of reduced productivity a year. Nationally, depression is estimated to cause 200 million lost workdays each year at a cost to employers of up to $44 billion. Depression increases healthcare costs and lost productivity indirectly by contributing to the severity of other conditions, such as heart disease, diabetes, and stroke. Depression is a complex condition that can affect any age or gender. It usually involves changes in thinking, mood, or behavior. The exact cause of depression is not completely understood, but it is influenced by a number of factors, such as genetics, chemicals in the brain called neurotransmitters, medical causes, such as a severe or long-term illness, personality and temperament, and environmental factors, for example, a person's physical environment and social support. Both work and non-work-related factors play a role in the cause of depression. For example, an employee may be particularly bothered by high-stress tasks or high-stress levels at home.
Depression is much more than an occasional bad mood. When a person is clinically depressed, they may have feelings of sadness and hopelessness, lasting 2 weeks or more. 1 in 20 people in the U.S. currently suffer from depression. So it follows that as a supervisor, you will most likely encounter a depressed employee.
The right screening and treatment for employees who are depressed can make a big difference. Select each tab to learn more. Treating depression with psychotherapy and medications can bring about improvement in 80% of sufferers. Employees with depression who received regular encouragement to continue with their treatment saw a 6.1 increase in productivity and 22.8% fewer absences over 2 years, and employers saved more than $2,600 annually for each employee. Remember that other mental health disorders frequently co-occur with depression, and for those people, physical safety and overall health risks are greater. The impairment of life skills is greater, and the chances for successful treatment are much less. Depression and other mental health problems often lead to alcohol and substance misuse problems. For instance, anxiety and depression may be brought on as a response to stressors from broken relationships, lost employment, and other situations directly related to a drug-using lifestyle. Alternatively, the existing depression may encourage the sufferer to misuse alcohol or other drugs to self-medicate to alleviate the symptoms of the mental disorder.
Researchers are starting to believe that in addition to depression affecting your employees' quality of work, the opposite may also be true. Certain job stressors, for example, high job demands, low job control, and lack of social support in the workplace, may actually be associated with the development of depression. For this reason, it is important that you, as a supervisor, are fully aware of and understand about different tasks and how much stress they may cause, as well as other aspects of job design that contribute to poor mental health. In identifying these triggers, interventions can be developed to help those with a propensity to develop a depressive disorder. In the second half of the session, we'll take a closer look at workplace tools you can use to help any employee who may be suffering with depression. Before we move on to a short test to see how much you are learning from this session, let's check in with our expert about how the workplace can have an effect on depression.
At work, an employee may present with unhappiness, fatigue, withdrawal, irritability, forgetfulness, and one of the most telling symptoms is losing interest in things that they once found pleasurable. If an employee has 2 or more of these symptoms, it may be time to have a conversation about depression. An exam by a family doctor is usually needed to rule out any other physical causes. The good news is that depression can be treated very successfully. Research shows that the most effective treatment for depression is a combination of therapy and medication.
Now, it's time to see how much you are learning from the information presented so far. When you're ready to begin, select Next. Select the correct option, then Submit. Now, it's time to ask yourself if you understand the information presented so far. For example, do you understand what we've said about what depression is, how it affects the workplace, the causes and symptoms, and how the workplace may in fact affect existing depression? It is important that you remember this information after the course is complete. Do you need to go back and review? Next, we'll take a look at what the law says and steps you should take if one of your employees is dealing with depression.
The Equal Employment Opportunity Commission, or EEOC, has developed guidance and regulations under the Americans with Disabilities Act, or ADA, addressing the employer's responsibility to make reasonable accommodations to employees with disabilities, including mental health problems. Reasonable accommodations are usually initiated following a discussion between the employee and employer. The employer is not required to provide accommodations that would create an undue hardship on the organization, and the employee is not required to accept accommodations that have not been requested or are not wanted. Examples of reasonable accommodations include changes in work schedules, job modification, and modifications to the work environment, like a change in physical workspace. The Family and Medical Leave Act, or FMLA, is another option for employees suffering from depression. This law allows certain employees who meet eligibility requirements to take up to 12 weeks of unpaid time off of work while still maintaining their workplace benefits. This law has many eligibility requirements, and also some states have different requirements. You should be sure you understand the full scope of your state's FMLA laws before granting any leave. In general, employees may request leave to care for their own serious health condition. Leave may be intermittent if both you and the employee agree. You may require the employee to provide medical certification. And finally, the FMLA provides a general definition of serious health condition that includes chronic conditions, conditions requiring multiple treatments, and conditions necessitating 3 or more days of missed work. This may include depression.
Employee programs refer to activities that include active employee involvement, such as classes, seminars, or competitions. Employee programs are frequently provided on-site at the workplace. Select each tab to learn more. Employee Assistance Programs, or EAPs, can offer information and referral services for employees with symptoms of depression. EAPs are one of the most effective ways to support employees with depression or other mental health problems by offering counseling and referral services. Worksite health promotions, such as physical activity in the form of sports teams, walking groups, and other active strategies, are good options for treatment in preventing and treating depression. Employees who participate in physical activity programs can decrease depression symptoms. Using training to teach managers and employees about the signs and symptoms of depression can help them recognize the signs and symptoms of depression, as well as help identify employees with depression earlier. Employee attitude surveys can also provide information about relationships in the workplace and highlight areas where improvements can be made. Surveys can ascertain information about relationships among coworkers, job demands such as time pressures or physical demands, and the level of support provided by supervisors and colleagues that may contribute to the mental health of workers. Applicants may have questions about whether and when they must disclose a disability, such as depression, to their potential employer. They may have concerns about negative consequences that may prevent them from getting a job. As an employer, you may not ask disability-related questions on a job application, but you can tell all applicants what the hiring process involves, such as a timed test. Then ask if an accommodation is needed for the hiring process. And require a medical exam after you offer the applicant a job, as long as you require the same exam for other applicants.
Now it's time to see how much you've learned about dealing with depression in the workplace. When you're ready to begin, select Next. Select True or False, then Submit. Let's take a moment now to make sure you understand the information presented during this training session. Do you understand what we've said about what depression is and how widespread it can be? How depression can have an impact on workplace tasks? What tools you have available in the workplace to help you manage employees with depression? And what the law says about depression, especially in relation to the FMLA and the ADA? It's important to understand all this information so that you can effectively manage employees who are dealing with depression. The key points to remember about this training session are: depression is a serious and widespread illness. Depression can have a big impact on workplace productivity. Depression is highly treatable and may be covered under the ADA and the FMLA. And know about the tools available to you to help employees suffering from depression. This concludes the training session on depression. Please be sure to go back and review any information that is not completely clear. If you still have questions, ask your supervisor or trainer.